A split screen shows a slide on the left with the title Pathways to Work, introducing the Pathways to Work Evidence Clearinghouse. The text is overlaid on an image of a woman wearing a headband and rolled up sleeves in an industrial work setting. On the right is the speaker, Diana McCollum of Mathematica. The Pathways to Work Evidence Clearinghouse logo is at the top of the screen.
Good afternoon, everyone. Welcome to the launch event for the Pathways to Work Evidence Clearinghouse. I'm Diana McCollum, and I'm Project Director for the Pathways Clearinghouse. And I'm also Director of Research and Evaluation in our Children, Youth, and Families Division at Mathematica. And we're just so honored to have such a strong showing for this event and to see so much interest. I acknowledge that the work that we're doing, it seems like it's very timely given the current economic climate we're in, the challenges we're facing with the pandemic. And, we recognize that there's likely a strain on administrators and employment service providers as they're helping to help their clients find work. And so today what we want to do is highlight how Pathways can be a helpful resource to administrators in that effort. And we'll do that by walking through the website to give you a glimpse of how to use it and by drawing on the experiences of our panelists. So I just want to acknowledge the broader team that's been leading and involved with this work. This project is really the vision of our project officers at the Office of Planning, Research, and Evaluation, OPRE, and they are Kim Klum and Claire DeSalvo. And today I'm also joined by another person from Mathematica, our principal investigator, Dana Rotz, who's going to be part of our Q&A session. And Mathematica has been conducting this work in collaboration with our partners on this effort, MEF Associates and Hager Sharp. And together we represent a team of researchers, communication specialists, website and user experience experts, and folks that are really pouring into the implementation details on different interventions. And we brought that experience to bear to create a website that's really user-friendly. So that has been our goal from the outset. And over the course of working on this project, we've had the pleasure of just engaging with a variety of stakeholders. And specifically, that's TANF administrators, employment service providers, and representatives from other community-based organizations, researchers and policymakers, sort of all together to pull their input into this systematic review effort and website. So we're just really excited to have this together and kick off the website launch.
The slide changes to show the webinar agenda that Diana discusses.
Right. So this is just a brief overview of the agenda today. We'll start out with some context and background on the clearinghouse and some opening remarks and reflections from OPRE. We'll do a demonstration of the website so that you get a sense of different ways that you can use and search on the website. And then we'll open this up for a broader discussion with our panelists and have some time for audience Q&A. All right. So with that, I'm going to turn it over to Naomi Goldstein from OPRE. And Naomi is the Chief Evaluation Officer at OPRE and the Deputy Assistant Secretary of Planning, Research, and Evaluation. So Naomi, over to you.
A new slide is titled Panelists, with the photos of each of the panelists. Naomi Goldstein of OPRE begins speaking and then is seen after a few seconds.
Thank you, Diana. I am so pleased to be here. And by that, I mean I'm really happy that the clearinghouse is ready for prime time. And we've reached this point through a great deal of thorough, careful, and thoughtful work by OPRE and NPR staff and NPR's partners. As Diana mentioned, the team consulted broadly, learning from the experience of other evidence clearinghouses and from the perspectives of potential users of the clearinghouse. The result is a rigorous review that presents a great deal of sometimes complex information in ways that are designed to be transparent and easy to understand. The clearinghouse builds on OPRE's previous employment strategies for low-income adults evidence review, and we were happy to have a statutory mandate to expand that work. The clearinghouse is meant to be a resource for practitioners, policymakers, and other stakeholders. And in order for it to be useful, potential users have to know about it So it's really gratifying that so many people are online to participate in this event. We had about 900 people registered. I also want to thank our panelists for helping us formally kick off this resource, and I look forward to the conversation. And I will hand it back to Diana.
Great. Thank you, Naomi. And now I'll introduce our other panelists. So today we have Kim Klum, who's our project officer on Pathways, and she's a senior social science research analyst at OPRE. And Kim's work focuses on adults with low incomes and issues of economic self-sufficiency and the application of behavioral sciences to human services. And she also focuses on racial and ethnic disparities across programs. We also previously had Thaddeus Ferber as a panelist from the Forum for Youth Investment, but Thaddeus has had a family emergency, and so he's not available with us today. But I just want to acknowledge that he has been a stakeholder in informing this effort for some time. In addition, we have Ella Gifford Hawkins, who's a Works Program Manager at the Larimer County Works Program in Colorado. And Ella assists Larimer County families to help them move toward enhanced economic stability. We also have Joseph T. Jones, who's founder, president, and CEO of the Center for Urban Families. Joe has been a Pathways Clearinghouse stakeholder, and the Center for Urban Families is in Baltimore, Maryland, and it's a nonprofit service organization that was established to help empower families with low incomes. We also have Alejandra Montoya Boyer, who's the Associate Program Director for Resilient Economies and Communities. She is responsible for the execution of a grant on county leadership and advancing economic opportunity. So welcome to all of our panelists. And now I will turn it over to Kim to walk through the background on the Pathways Clearinghouse.
The slide at left is titled Consolidated Appropriations Act of 2017. The speaker, Kim Klum, reads the detailed text of the slide.
Thank you so much, Diana. And again, as Diana and Naomi said, we're so pleased to have so many of you join us for this big launch event for our clearinghouse, especially showcasing of the website. So to repeat what Naomi referred to, the Pathways to Work Clearinghouse was initiated by the Consolidated Appropriations Act of 2017. And in that act, we were directed at HHS, the Department of Health and Human Services, to create a database of projects, or what we call interventions, that have used a proven or promising approach to move welfare recipients into work. The act called for us to conduct a systematic evidence review to find interventions that could enable us to best understand what helps job seekers who are low income succeed in the labor market. And then importantly, in addition to conducting that review, we were directed to categorize those interventions by their evidence of effectiveness. So to fulfill this directive and to create the public database of these findings, the Office of Planning, Research, and Evaluation launched the Pathways Clearinghouse. So the Pathways Clearinghouse has 4 goals. The first is to conduct a systematic review. So that's to conduct a systematic review of the impact evaluation literature on employment and training focused interventions, specifically for individuals who are low income. The second goal of the clearinghouse is to rate those interventions according to criteria that we've pre-specified, and then to determine what that evidence says about the intervention's effectiveness. So in particular, we rate the intervention's ability to affect earnings, employment, benefit receipt, public benefit receipt, or education and training completion. And we use the terms well-supported, supported, not supported, mixed support, evidence, or no evidence to distinguish among the different levels of evidence for those outcomes. The third goal of the clearinghouse is to present the information on a high-quality, user-friendly website that makes it easy to access the review's findings and to access supplemental materials, including materials that look across the findings on different interventions and synthesize what we can learn from looking across those different interventions. And last but not least, as Naomi also alluded to, a very important and a very active goal for us in creating the Pathways Clearinghouse is to promote it. So because we want it to actually be a tool that's not just exists, but is actually used and useful to the field. So one of our goals is to make sure that key stakeholders, including everybody on today's webinar, are aware of the website and understand how it can be useful to them.
The slide at left is titled Audience, with bullet-pointed text that Kim Klum discusses.
So the primary audience for the Pathways Clearinghouse is direct employment service providers, TANF directors, and other program administrators who serve a low-income population. The site's designed to be what we hope to be a user-friendly resource for any program operator who's seeking to help job seekers who are low income, and to provide information that's accessible and understandable and gives people quick access to the existing evidence on relevant interventions. So we also have another key audience for the clearinghouse, are policymakers and researchers. And for those users in particular, we've provided a lot of information that digs into the actual research itself. So it provides a lot of information at the study level that describes the study quality and details about how the study was conducted.
The slide at the left is titled Website Features and Products, with bullet-pointed text that Kim Klum discusses. To the right of the text is a screenshot of the website.
And just before I transition it back to Diana, I just want to give you a very big picture overview of what you'll find when you use the website. So as Naomi and Diana both already mentioned, the Pathways to Work Evidence Clearinghouse, it's a very user-friendly website, and it's been designed to meet the needs of administrators to support the use of evidence-based practices. As you'll see in a moment when Diana previews and gives us a tour of the website makes it very easy to find what we consider interventions that work and to access a considerable amount of information about those interventions, and to learn about other interesting things going on in the field as well, such as interventions that are currently being tested using a rigorous research design but don't yet have findings. We call those developmental interventions. And untested but interesting practices or projects that are that we've learned about in the field. We highlight those as case studies. And with that, I'll give it back to Diana.
As Diana McCollum begins speaking, the home page of the website shows full screen. The web page is comprised of a banner at the top with the Pathways to Work logo, and to the right are links to sections titled Find Interventions That Work, Other Pathways Resources, About, and Help. Below the banner is an image of a woman wearing a hairnet working in a cafeteria setting. A text box to the left gives a general description of the clearinghouse. Just below the image is an icon of a person wearing a mask with text that reads, Few interventions that are currently supporting individuals remotely during the COVID-19 pandemic.
Thanks, Kim. So I've transitioned over to the website to give us all a demonstration, and hopefully you all have had a chance to take a look at the website, but I'll walk through some highlights and give you a sense of some of the intended features. All right. So as you arrive on the home page, the first thing you see is a brief statement that talks about the purpose of the Pathways Clearinghouse and walks through a lot of the background that Kim has provided. So if you click on Learn More, you can find out more of the background there. And at the top of the page, our menu highlights areas that we think employment service providers and administrators will want to spend the most of their time, and that's on the Find Interventions That Work feature. And this is a tool that'll help you to explore and compare the effectiveness of interventions that are designed to help job seekers with typically that have low incomes succeed in the labor market. So we'll briefly get to a broader demonstration to show you how to use that tool. So I wanted to highlight some other aspects of the home page that you all may have seen if you've been on the website in the past week or so. So we have this resource that we've compiled that allows users to see which interventions are currently supporting remote delivery in response to COVID-19. So if you click on this link,
Diana clicks on the icon and View Interventions text to go to a page titled Interventions with Responses to COVID-19.
This is a list of interventions that we have looked at where we've conducted a review of the interventions and the underlying studies, but we've also gone on to each individual intervention's website or the website for the organization to see if they were currently offering some services remotely. And so that previous list shows interventions that have indicated on their websites that they have some remote services, and you'll be able to find those interventions by finding this particular icon across the site. So we just wanted to highlight that as another resource that we've added.
Diana goes back to the home page and scrolls to the bottom of the page that has sections showing the number of interventions and studies reviewed to date, a video on how to use the site, and an email sign-up form.
Just scrolling down toward the bottom of the page, we also provide some very high-level information about the number of interventions that have been reviewed to date and the number of studies that are feeding into those interventions. One other thing you may not have seen yet, but we'd hope you'd take a look at, is we have included a video here that provides a sense of how administrators might use the website overall. And the video really provides a perspective of a job seeker in addition to other Pathways Clearinghouse stakeholders to provide a sense of how you might use this resource and what benefit it should provide to administrators. So certainly take a look at that video when you have a moment. All right. So let's transition to the Find Interventions That Work tool.
Diana scrolls to the top of the page and clicks on the linked text for Find Interventions That Work. The page has a banner at the top titled Find Interventions That Work. Below the banner on the left is a box with 6 effectiveness ratings. The ratings include well supported, supported, mixed support, not supported, and insufficient support, and no evidence. Below this box are filters for sorting by intervention name or characteristic, filtering for favorable outcomes, and filtering to show similar populations or services. A text box below these allows for filtering by date range. At right, results of the search will show.
All right. So this is a feature that provides a listing of all of the interventions that we reviewed to date for the Pathways Clearinghouse. And so one of the first things you'll notice on this page is a key for the effectiveness ratings that are used by the Pathways Clearinghouse. So these ratings are really an assessment of whether an intervention is likely to produce favorable results if faithfully replicated with a similar population that was included in the original study. And you'll see that when you hover over the different effectiveness ratings, you get a definition of what that rating really means. And so if you hover over the supported rating, for example, this is showing that essentially when you see the supported rating for a particular outcome domain, it means that there's at least one study of high or moderate quality that has favorable findings. Right, and you can see that for each of the icons. If you hover over, you get a more robust definition. And you can also pull up that information, those definitions, by clicking on that hyperlink that connects you to the terms. All right. So next, what we want to highlight on this page are filters that help you really drill down to some of the questions that you might have, particularly as an administrator if you're looking for different interventions. So these filters here select the outcomes you want to improve, select characteristics that describe your clients, and select services that the intervention should provide are ways that we've identified to help give you a start to finding different interventions. So let's walk through a potential example. Suppose you're interested in looking for interventions that have been evaluated that have shown that they've increased earnings and increased employment. So then you could just click on those options within that filter, right? But you also may know more or have more specifics in mind when looking for a particular intervention. So for example, among many characteristics that may describe your clients, one that may stand out to you, for example, is that you have many clients that are parents. And so you'd click parents to make sure you're identifying interventions that specifically targeted parents, for example. right? And you may also have a sense of the kinds of services that you're looking to provide and want to get a sense of the available evidence for those services. So let's walk through an example where you may know that you want to look for interventions that use work and work-based learning approaches. And by clicking that filter, the search will provide you with interventions that use any of these approaches. All right. So you can use the search and by selecting apply.
As Diana clicks Apply, the screen updates to show the filtered results. The table of results has headings for intervention name, along with the effectiveness rating for whether the intervention increases earnings, increases employment, decreases benefit receipt, and increases education and training. The icons shown below each heading correlate to the effectiveness rating box at left. Also shown in the table are headings for population and employment barriers, services provided, number of selected population characteristics and services matched, and a checkbox to compare the interventions.
And you'll probably have noticed we had 161 interventions within the Pathways Clearinghouse, and this whittled the list down to 49. And so this provides a sense of all of the interventions that meet the criteria that were specified, but the interventions, additionally, they're listed alphabetically by intervention name. You might want to sort by the number of characteristics that match the population or services characteristics that you had highlighted. So you can sort by that so that the interventions that are coming up at the top are really the ones that match the most characteristics that were identified. And you can see that, the search bolds those characteristics that you selected. So we said we were interested in interventions for parents and that had work and work-based learning experiences. So those are bold. But you'll notice that for each intervention, what pulls up is a snapshot of the intervention and a sense of the effectiveness ratings across the 4 outcome domains that Kim mentioned previously. Okay. So just scrolling down this page, let's take a look at one of the interventions just to get a sense of the additional information that's provided.
Diana scrolls down the page and clicks on the link for the Parents Success Initiative.
So this is a page that's typical of many of the interventions on the Pathways Clearinghouse site, and that we provide a bold statement that describes the goals of the intervention and then the population served. And then also we have a paragraph or 2 description that talks about the services that are provided in a given intervention and highlights sort of the duration and service intensity and the staff that were involved in delivering the intervention. So these intervention details are all intended to give you just a high-level snapshot of what this intervention is about. And you'll notice in the gray sidebar, there's also information that highlights sort of the key population and the specific services that are included as part of this intervention. So, we did select specific ones under work and work-based learning, but this gives a snapshot of the other services that are included as part of the intervention. And you'll notice that you can also skip to information that we think users will be most interested in. So first, let's go to the effectiveness ratings.
Diana scrolls to the left of the screen that has links for effectiveness ratings, implementation details, and studies of the intervention. The page shows a table with rows at left for the outcome domains of increase ratings, increase employment, decrease benefit receipt, and increase education and training. The column headings are term, effectiveness rating, effect in 2018 dollars and percentages, effect in standard deviations, and sample size. The term column has 3 rows for each outcome domain to show the results for short-term, long-term, and very long-term. Each row has an associated icon for its effectiveness rating.
So this table takes you to the effectiveness ratings that we saw on the previous page and shows, it provides a deeper view across the outcome domains. So you can see whether the interventions had outcomes with effectiveness in the short, long, and very long term. So just looking at this example, we see that the Parent Success Initiative intervention improved comparable to an increase in earnings of $774 a year in 2018 dollars. You'll also notice that we provide information about the effect in standard deviations so that you can compare the effects across different outcome domains to get a sense of the magnitude of the effect. And the sample sizes are also included, and this is all information rolled up from the individual studies. One other thing to point out, I mean, when you're looking at these pages, again, you can click on that or you can hover over the icons to get a sense of what they mean. But this is also showing that there's insufficient evidence for an effect on long-term earnings. And that means that there's some evidence from moderate or high quality study that, but there's a sufficient body of evidence to make another determination for the effectiveness rating. So scrolling down on this page, when an intervention has at least one outcome that's supported across outcome domains, what we try to do is include information on the implementation details for those interventions. And you'll see that this provides an even deeper dive into, a sense of the organizations that implemented the intervention, the population served. So you'll recall that we searched for parents and in particular, and this provides even more detail saying that the program served unemployed and non-custodial parents primarily. And then there's also a breakdown of the race and ethnicity of the participants that were in the evaluation. There's also a broader description of the services implemented, service intensity, and I think you get the idea here. But the sense is that for those interventions with a supported outcome, we are going to provide information on the implementation. And then at the bottom of this page, you'll also see information about the studies that were reviewed for this intervention. So if you click on the studies link,
Diana clicks on the text link for View Studies for this intervention. This page has a banner at top with the title Search for Studies. At the left are filters for doing a keyword search with the study, a checkbox to choose study quality of high, moderate, or low, a pop-up listing of interventions, and a pop-up listing of the settings in which the intervention was studied. The main part of the screen at right shows the study title along with the study quality and the publications that supported the study.
That'll take you to the page that identifies the study and provides information about the quality of the study and the supporting publications that contributed to the rating. So let's go back to the home page for a moment, and I just want to walk you through one additional example of how you might use Find Interventions that work.
Diana clicks on the Pathways to Work logo at the top of the page to return to the home page, then clicks on the Find Interventions that Work link in the banner at the top of the page. From this page, she scrolls down on the left side and clicks on Select Characteristics that describe your clients to expand the choices. Scrolling down, she clicks the box for young adults aged 16 to 24.
So suppose you're interested in interventions for a particular population and you just want to see what the available evidence is. So let's take youth, young adults ages 16 to 24 as an example and see what the search yields. So here the search identifies 14 interventions, and I just want to clarify really quickly. This is 14 interventions of employment programs that specifically targeted ages 16 to 24. There are likely, and there probably are other interventions that where the population may have included some youth, and you can find those interventions other ways. So I'd encourage you, if you were interested in youth, to also use other parameters to search and see the exact population. But again, this is highlighting those interventions that exclusively focused on youth populations. So you can see that the search provides the same information sort of across interventions and across outcome domains. But one thing I wanted to highlight here is that we also have a feature called Compare.
Diana clicks on a small box in the last column titled Compare to choose those interventions. At the top of the page is a button Compare Selected, which shows a table of each intervention and its characteristics,
where you can get a side-by-side glance of what the primary features are for each intervention and a sense of what the effectiveness ratings were across outcomes, like looking at each intervention side by side. So I just selected some interventions and then hit Compare Selected, and it provides this page where you can look at each intervention, taking Year Up, for example, and seeing that it offered training and work experience in information technology, and the Young Adult Internship Program that provided internships and work-related services. So you get the idea here. It's really to give you a snapshot of what the key services are across interventions, the settings that they were tested in, and the year the evaluation began. And most notably, I think folks might find it useful to look at the information on the specific effectiveness ratings kind of broken down across short, long-term, and very long-term when comparing them across different interventions. All right. So now I'll go back to the home page.
Diana clicks on the Pathways to Work logo at the top of the page to return to the home page, then clicks on the Other Pathways Resources link in the banner at the top of the page, and then clicks on the subheading of Developmental Interventions.
And I know we spent a decent amount of time on the Find Interventions That Work tool, but I just want to point out some other helpful resources. So as Kim mentioned, we also include developmental interventions as part of the Pathways Clearinghouse. And this is to provide a sense of new research that's underway and in the pipeline on employment-focused programs. And these are interventions that have a rigorous design, and they're currently being evaluated, but findings are not available yet because the study is not complete. And this is to give users a sense of the evaluations that are in the pipeline. All right, so we list those on this page.
Scrolling back to the top of the page under the header for Other Pathways Resources, Diana clicks on the subheading for Protocols for the Pathways to Work Evidence Clearinghouse, Methods and Standards.
We also, as another resource, I know many folks may be interested in seeing the specific protocol for the Pathways Clearinghouse that describes the study designs that are eligible, the methods and procedures that we use to review studies and for grouping studies into interventions. So you can access that PDF as well if you're interested in more details there.
Scrolling back to the top of the page, Diana clicks on the subheading for Case Studies under the header for Other Pathways Resources.
And finally, one other resource that we have, which we will continue to add to, is information on case studies. And case studies are examples of interventions that have not yet been rigorously evaluated, but we found out about them through stakeholders and other sources, and they're interventions that are popular or are in use. And so we wanted to be able to highlight them to provide a sense of other interventions that administrators may be using. So these are ones that have not had a rigorous evaluation yet, but it's a place to include information about other approaches that are operating in the field.
Diana clicks on the Pathways to Work logo at the top of the page to return to the home page.
So I'll just come back to the home page really briefly and walk through a couple of other highlights and updates. So one thing I mentioned is that for those interventions with a supported outcome and at least one outcome domain, we have implementation information for those interventions. And we have that up for about 10 interventions right now. And over the course of the rest of the year, we are rolling out that information so that implementation information will be provided for more interventions. So that information we'll continue to update that really through early next year.
At the top right of the screen is a small vertical gray box that reads Stay Connected.
Another update I have for folks, and many of you have probably seen this as we see the activity for signing up for the listserv, but you can, from the home page, hit the Stay Connected bar and sign up for the Pathways email. And the kinds of email updates that we will send could include information about, for example, when we have another set of implementation details added to the website, or when we sort of update and add new reviews and interventions. And one additional thing to mention that we highlighted in the beginning is that we are continuing to review studies and interventions for the Pathways Clearinghouse on an ongoing basis. And we will be sending an email shortly to everyone that signed up for this event and that signs up for email updates. But we'll have a call for studies that specifically looks at studies that have rigorously evaluated services that are offered remotely, or services offered, at least some services offered remotely. So that call for studies will be coming out very soon, so look out for that. All right, so if you have questions about anything I've demonstrated, please feel free to submit a question in the Q&A widget, and we can get to your question when we get to the Q&A portion of this. So now I'm gonna stop sharing my screen and we'll transition over to the Q&A portion of the event.
The view transitions to a split screen with Diana speaking at right and a slide at left titled Live Panel Discussion with photos of each of the panelists.
All right, so at this point, we're going to walk over to each of the panelists, and I'd like to invite each of the panelists to provide an introduction of yourselves to the audience today. And really, I'd like for each of the panelists to talk about your current role and how evidence is involved in decision making and times when you've sought trustworthy information about evidence, about what works. So let's start with Naomi.
Naomi Goldstein is shown in the speaker window at right.
Thank you. So as mentioned in the introduction, I'm the director of the Office of Planning, Research, and Evaluation. And so I oversee the talented people who have done this work. In addition to informing the field of policy and practice, an evidence review like this is also a really useful tool for research planning because it can illustrate where there are gaps in the research. So it's not perhaps the primary purpose of the review, but it is certainly a major useful facet of the review. And then this is not directly in response to that question, but well, maybe it is. So I just wanted to say that one of the things that I think is extremely important about a systematic evidence review like this is its systematic nature. So when we've aimed to be very transparent about the rules and procedures and criteria that lead to the ratings in this evidence review. So that means when you look for an assessment of the effectiveness, of the evidence of effectiveness on a given intervention, you're not getting somebody's subjective expert opinion. You are getting a review of the evidence where all the interventions and all the studies are looked at on a level playing field. And sometimes that does lead to different assessments from other reviews that use different criteria or from more subjective assessments of the evidence of an intervention. Some interventions are famous because they've had a lot of publicity, but they don't necessarily have the evidence to back that up. And other interventions are less well known, but have strong evidence. So in a systematic review like this, you can be confident that all of the studies and all of the interventions were reviewed using the same rules.
Thanks, Naomi. So Ella, I'll turn that same question to you.
Ella Gifford Hawkins is shown in the speaker window at right.
So we started using the concept of evidence-based information. Oh, let me step back. Ella Gifford Hawkins, Larimer County Works Program Manager. And so that means that we serve individuals who are receiving temporary assistance for needy families. About 7 years ago, we became kind of discontent, thinking that we could do a better job of how we were providing program services. We were introduced to Mathematica and they provided technical assistance, but really what that did for us is it opened the doors to a much larger world of research and evidence-based practices. The way we use it, we look at the information And then we look at the problems or the challenges that we have. And then we try and figure out how we can do step-by-step improvements on the services that we provide. Because we're a large county in Colorado, but relatively small, maybe compared to some other states, we didn't want to overwhelm staff with change. So using evidence-based information and practices allowed us to control the pace of change and make decisions about what did we think would be the best change for us to manage in an environment where you have staff who are extremely busy meeting with folks, doing a lot of data entry, paperwork, things like that. So it helps us save time if we have information about evidence-based practices. And we use that on a regular basis now. And if you had told me 7 years ago that the way I approach problems and the way we look at the world of program services would change this drastically, I probably wouldn't have believed you. We use it on a regular basis. We also would look at other pieces of the clearinghouse that would include the case studies, because some of the practices we want to change might be, say, smaller in nature. So all of that information is helpful to us.
That's great. Thanks, Ella. So Joe, I'll turn the same question over to you, and you can start with a brief introduction as well.
Joseph Jones is shown in the speaker window at right.
Sure. Hello, everybody. I'm Joe Jones, founder and CEO of the Center for Urban Families in Baltimore. Our tagline is helping fathers and families work. And, first of all, Diana and Naomi and the entire teams at OPRE and at Mathematica, it has been an honor to be one of the stakeholders with others that have met and worked through and made suggestions. It's not easy bringing practitioners and researchers and policy makers and wonks together, but that process, and particularly the way in which we establish boundaries around mutual respect that had each discipline able to contribute equally. And I know sometimes I can stress the envelope, so it's great to be in a space where you can think freely and get slapped back a little bit, and then you come up with a product that is a result of the clearinghouse. So thank you all for that. For me, it's, we work with folks who are very, very vulnerable, particularly at the beginning, at the time that they access services, and they're looking for an opportunity. And sometimes, particularly as a practitioner, you can feel like you're doing the very best. But it's not always evidence informed, it's evidence feel good. And so having an opportunity to have a site like the Clearinghouse where I can use information that helps me to inform program design on the front end, and to have a trusted source. We're in the age of information overload, and not all information is trustworthy. And so having access to that kind of information that's evidence informed, is systematic, it is, again, coming from a trusted source, allows me to have the information I need to think about programming up front. And then lastly, it's thinking about, once you're into program operations, we're in the midst of, trying to make a lot of change in the lives of people, and being able to have information available to make mid-course adjustments in programming as you come up against new challenges and new opportunities, and have that evidence at the ready to help inform the decisions you make, even in the midst of a current intervention. And so for me, that is the value of, how I use evidence and the value of the Clearinghouse tool.
That's great. Thanks, Joe. And last but not least, I'll turn to you, Alejandra. And just for everyone in the audience, I'll just remind you of the question. So panelists are giving a brief introduction to themselves, but we're asking panelists to reflect on how evidence is involved in their everyday decision making, and to offer up examples of how they've used trustworthy information about evidence for particular interventions, and to just give some examples of times they've done that. So Alejandra, over to you.
Alejandra Montoya Boyer is shown in the speaker window at right.
Thank you. I'm Alejandra Montoya Boyer, and I'm the Associate Program Director for Resilient Economies and Communities at the National Association of Counties, and we represent the 3,069 counties across the country. As a member organization, our entire job is to be a conduit for tools and resources like this. So using evidence-based practices and finding these solutions is my entire job, and my goal is to be able to provide resources like this for our counties. And because we work with such a diverse membership, small counties, mid-sized, large counties, all with very unique challenges in supporting low-income job seekers and workers and families. Tools like this are really essential for us to be able to provide multiple examples and evidence-based practices that can fit different counties, or at least be able to provide ideas on what different counties can do, even if it's not a direct scalable solution or a direct one-to-one replicable intervention. Counties can still take those ideas, translate it for their own needs, and provide resources for their residents in an effective way. We do this across all of our practices. Our programs are built on the idea that we find resources like this, or we work with partners like Mathematica to be able to develop these type of resources. And so I could list hundreds of examples that we do here, but this is our bread and butter. NACO really sees itself as a conduit for researchers to practitioners and folks on the ground leading county governments. So I'll stop there so we can get into the actual questions.
That's excellent. Thanks, Alejandra. I think we have really wide representation across this panel, and we'll just jump right in with our questions.
The slide at left is titled Panel Discussion. Below is a question that reads, what is the value of a resource like the Pathways Clearinghouse that focuses exclusively on employment and training programs for individuals with low income?
So the first one, and I'm going to pose this to Naomi, it's really thinking about the fact that systematic reviews and clearinghouses are really prevalent right now. And so what we want to talk through is what you see as the value of a resource like Pathways, and with the focus specifically on employment and training programs for individuals with low incomes. So Naomi, can you speak to that?
Sure. So, helping people with low incomes achieve independence and steady rewarding employment is a long-standing and key goal of policymakers across parties and administrations and decades. So it's a key area in which evidence is needed. I'll note that this clearinghouse, or the policy context for this clearinghouse, differs in some ways from some other clearinghouses. So OPRE oversees two other clearinghouses, the Home Visiting Evidence of Effectiveness Clearinghouse, that looks at effectiveness of home visiting interventions to inform the maternal, infant, and early childhood home visiting program, which is jointly overseen by the Health Resources and Services Administration and the Administration for Children and Families. And I may have just won the prize for most most federalese language in one sentence. And we also oversee, but I might be about to top it. We also oversee the Family First Prevention Services Clearinghouse that informs the prevention services that are, per legislation from a couple of years ago, now reimbursable by the federal government. And a key difference between this clearinghouse and those clearinghouses is that those two clearinghouses determine what interventions are eligible for federal reimbursement. So in both of those contexts, the statute limits some of the federally available funds to those interventions that have been found effective through a systematic evidence review. This clearinghouse is for information purposes. So we hope that policymakers and practitioners will use the information here to choose interventions that are both proven effective and appropriate for their context, but there is no money attached to the finding of effectiveness. So that one possible implication of that is that the level of scrutiny might be it may be just as high, but it won't be as emotionally charged for this clearinghouse as for the other two that we oversee. And I'll stop there.
That's helpful, Naomi, and it's a really important distinction that this clearinghouse is not tied to federal funds. It's a question we've received other times, so that's helpful.
The next slide reads, how do you currently access information about what works in employment programs for individuals with low incomes, and how do you think the Pathways Clearinghouse site might help you in your work?
So we'll move to a question that really is intended for Ella, Joe, and Alejandra. And this is about the way that you currently access information about what works for employment programs, specifically for individuals with low incomes. And if you can just speak for the audience about how you think the Pathways Clearinghouse site might help others in their work specifically. All right, so we'll start with Ella.
One of the ways that I think it will help is that it consolidates information. Speaking for myself, I subscribe to a number of email newsletters, I go to conferences, I listen to webinars. And when you think of that and trying to compare and contrast the information that you're getting, that means that you're doing that individually. When you have the clearinghouse, you can use the tools on the clearinghouse to compare and contrast that information. It can also spur creativity because there will be ideas on the clearinghouse that maybe you had not considered. So when you have something in one spot that has ways of sorting, finding information, and it's focused on employment, it can save time, it can spur, again, creativity, and it becomes a useful tool that is easy to use.
That's great. Thanks, Ella. So Joe, to you, the same question.
Yeah, it's kind of an interesting question given, my comments prior about, information overload. And, I'm connected to a number of networks and individuals. Historically, we've had university partners, but the information can be so diffuse. And with limited amount of time, now that we've accelerated into COVID, it seems like, Zoom calls are back to back to back. I don't know if we have time to exhale anymore. And so for folks who are really, really, really busy in general, and more so now, trying to identify information that is, scattered, it takes time to navigate, that you really need a basis for something that's going to attract your attention and generate the kind of personal interest for you. Each of us have different learning styles. And so, it's really important that we think about, at least for me, we think about what becomes more efficient for you in searching. And so the clearinghouse site, it does have a bit of a gaming feel to it. You know what I mean? For people who have that particular interest, I'm not a gamer, but I have folks in my family who are gamers. And when you look at the site, and I'll be honest with you, I've brought my kids into the clearinghouse to allow, because some of them are geeks and they love this kind of stuff, right? They don't necessarily know the subject matter per se, but they do know what a well-informed site looks like. And so, having this tool that will allow me to spend less time in multiple sites is what is a key feature, for me. And then the other thing is that by nature, I'm a fatherhood practitioner that has a very keen interest in helping fathers and families achieve stability and economic success. And I'll tell you, there's one feature, this is kind of personal, right? When you go into the search function and you type in the word fatherhood, it takes you to all of the key interventions that have informed the field, from informing Congress to informing government leaders at the state, local, and federal level, to informing the field in general. That, for me, was one of the highlights of seeing the site populated. And so, think about what your particular interest is, type it into that field, and be surprised at what you come across that is well-defined, The effectiveness rating is a highlight because it's user friendly, and it allows you to be able to have access descriptions of particular titles that make it less complicated for you to spend time trying to figure out what it is trying to define.
Yeah. That's really helpful, Joe. And I like what you were saying in the beginning, too, about this being, really a central resource in a time when, I'm sure administrators are always busy, but you talked about the nature of things right now. And, it reminds me of a conversation Ella and I were just having at the beginning of this, thinking, people might, be interested in looking for information on interventions that were offered remotely, right? And so I mentioned that call for studies. We want to be able to review the literature on any interventions for employment and training purposes that have been implemented remotely, so that we can be that resource there for pushing out more information about what folks are interested in. So that's absolutely the way that I characterize it. So Alejandra, to you, I want to go back to this question of how you currently access information.
Yeah, I think no county has the perfect systems, and every county is different. And so to answer that question is really challenging for me. But I think one of the things that we hear about most from our members is that the consolidation of information is both critical and very challenging. So the Clearinghouse provides a resource that is available for audiences across sectors and across policy arenas and departments. So for example, the opportunity to connect disconnected workers and youth with formerly incarcerated members, with low-income workers, and see interventions across those systems are really critical, because in a lot of our counties it's not possible or the systems are not set up effectively for cross-collaboration and cross-communication. Data systems are really antiquated that way. And so as our counties are working to innovate and work to bring together integrated systems and find solutions that work across these sectors, because that's how residents experience these issues. Residents don't, a resident of a county doesn't experience it like, oh, well, I go to the human services department for this, and then I go to this, and then I go to an American Job Center. It's all just their life, and we need to be able to experience and find solutions across that. And so resources like the Clearinghouse that provide information across those systems for our counties are always critical. The other thing is, for a lot of our counties, and particularly our rural counties that don't have the capacity to have evaluators and data experts to be able to see an effectiveness rating, I mean, that's going to cut out an immense amount of time and work for a lot of our counties to be able to say this has been tested and reviewed, and we're seeing these kind of effectiveness. That right there is a huge thing for a lot of our members. And so I think more resources like this that can kind of bridge a lot of those gaps to access effective information for low-income workers are going to be critical. And I'm also really excited to hear, really excited to hear about any interventions that were implemented remotely, because that's, I think for everybody, probably like one of the number one or a huge issue as we move into economic recovery. And it's something that we're really trying to rethink and adapt. How do counties provide services remotely? And workforce development and training and job seeking opportunities is one of them.
That's really great. Thanks, Alejandra. All right, so we'll move on to the next question.
The next slide has 3 questions. How do you suggest that other administrators or directors could use the site? Which features could be most useful? What kinds of information might be most valuable now for direct service providers?
And this question is for Ella and Joe. And given your experience with the Pathways Clearinghouse so far, you both began to talk about this, but let's just dig a little deeper about how you'd suggest that other administrators or directors could use the site. And again, I think both of you have started to touch on this, but tell us about some of the other features that might be most useful or some of the ways that that information on the site may be particularly valuable.
Do you want me to start, Diana?
Yes, Ella, sorry, you please go ahead.
So when we started this work, and I think it was over a year ago, one of the most valuable pieces was the shared experience between researchers, practitioners, and others. And what you discover is that you all share similar problems, and then there's some problems that you have or challenges that are completely different. So when I look at the clearinghouse, it applies to different practitioners in different sites and different populations. And if we all have these challenges, and if you can start searching on the clearinghouse and really focus on what some of your challenges are and see what other practitioners have done, it can help you figure out how you might address your challenges. And I think one of the responsibility of administrators is not just the problems that you have today, or what are the problems or challenges that you see coming down the road? And can you look for those as well on the clearinghouse to give you an idea of how to prepare your agency, your staff, your customers? At the end of the day, we have responsibility to serve our customers well. And we know that moving into employment that means something to the families that we serve is a critical part of their lives and their ability to make sure that their children have a great future. So when I think of it as a community where we share ideas, you have information at your fingertips, and it's a way to participate in that solving challenges together.
That's great. Thanks, Ella. So Joe, I'll turn it to you with the same question.
Yeah, there's a little bit of overlap because I got kind of excited about talking about the site, and I can't believe I'm saying I'm excited about a website, right? But so much has gone into this, and particularly because it's a tool to help people who are economically aspiring, who need, in some cases, they need a lot of help. In some cases, it's just a little bit of a push. In some cases, it's just access to information. And administrators, for me, I think about the tool being something that, even if I don't have the time, I would really strongly suggest to administrators that you dedicate a little time, an hour or so, pull that time away and just get familiar with the site. Spend some time going through it. And then thinking about, team members who you have who could serve sort of like as a co-pilot with you. I think sometimes we're given too much reverence for the positions we held, and sometimes that's a good thing, right? In this instance, I think it could be, a tool that could be used to really incentivize team members to get familiar with the site and ask them to brief you on what they learn about the site. I think about holding team meetings where, I dedicate some time to having my team go through the site together, since it is about providing information that helps inform decisions we make around the population we care deeply about. And, the other features on here that are, they're complementary to the main purpose of the site, but it's the glossary of terms. It's the frequently asked questions site, right? It's that compare site, right? And, in this space that we're in, where we're really challenged to really think about the authenticity of information and credibility, right? And this source has to be a credible messenger as it relates to evidence, right? And when I think about and this is a little granular, but I really wanted people to, we don't have time to go through the entire site today, but under the frequently asked questions section, there is a question there, and it says, can I appeal the rating that the Pathways Clearinghouse has applied to my study, right? Now, how more open can you be? And the answer to the question gives people who may have a question about their study, some recourse. And that helps to build credibility to the site, right? And I think it's those kind of features that are really helpful in the long term that will allow more and more people to feel like this is a legitimate site. The evidence and the interventions are fully vetted. And the last thing I think was I forgot who it was. It was either Naomi or Clem who mentioned that the fourth goal of the site is to promote it. And all too often, we develop tools, strategic plans, and other products that are really meant to help intentionally, but they kind of sit, and we don't do as good a job of making sure that the community, whatever the community is aware that it exists, and to walk people through it like we're doing today. So that's sort of like, my experience, with the site, so far. There's quite a number of features, right? But it is that kind of site that when you go to it, you sort of like have a good experience. And when you leave it, you remember you had a good experience and you want to come back to it at some point. And I don't know about you, but if I go to a supermarket and I don't have a good experience, the likelihood that I'm going to patronize them again is slim and none. And with the clearinghouse, I think leave the site feeling like it is a place that you had a good experience and you would like to revisit, and you would want to recommend it to somebody else.
Thanks to you both. And
something real quick.
Oh, yes, please.
So I would like to echo what Joe said about frontline staff. I assume that's what he was talking about. I think really to implement change, you have to involve your frontline staff, and they are often the first to identify some of the very challenges that we seek to resolve. The other part that I would talk about on the site is what you talked about earlier, implementation. Folks often talk about what in theory it takes and the results, but the people who actually have to implement those changes in practices, we need more information on that, so that helps, because at the end of the day, if you don't implement well, none of this information is going to be that helpful.
That's really helpful, the points that you both are highlighting. I mean, Joe, I think you talked about sort of the nature of the site being that it's systematic, that everything is very transparent, and just highlighting that there's a process for if you're interested in having your intervention review, that is a systematic process as well. And we have really tried to make information available on this site so that folks can see, how transparent, get to know how transparent the process is. I just wanted to address some other questions that I think have been coming up in the Q&A that seem really relevant to what we're talking about, right? So this website is a public site that everyone can access, just for the reasons that Joe and Ella have mentioned. And the review is systematic in our approach to our search for the interventions to review, and in addition to the information that we provide across interventions. That was a major point that we wanted to embed in the review process and then on the site as well. And I think some other questions are coming about this, but we wanted to make sure that and part of this is being a systematic review, all of the reviewed studies needed to meet certain criteria. And the criteria are really spelled out in the protocol. If there are more specific questions about the criteria, we're happy to address them in the Q&A as well. But just wanted to highlight that point. But before I take up more time, let's go ahead and continue with some of the other questions that we have for the panel.
Diana, could I just add one thing to what you just said? So
please.
This is Kim, and I just want to add, because I was also seeing those kind of questions in the Q&A, which is just really great. But just to kind of build on what Diana said, the process that we use to review the information is very systematic, very transparent, and we're very rigorous about the objectivity of our process. As Joe also mentioned, we have a process where if somebody who had a study that was reviewed in our review wanted to question anything about how we reviewed it, we're very open and we also have a very transparent process for how we conduct that review. But I did see that in the question, some people are asking, how do we get the information about what studies or what projects or interventions to review? So our team, Mathematica, does a very systematic search for information, but we also are very happy to get information from the field. So we do a very kind of rigorous and systematic approach to trying to get all the information we can about the research that's out there. But we're also want to make sure that, we might not be able to find everything. So if there's interventions or projects that you know about that you'd like to submit to us, you can email it to our our email address, which is on the website, and we review them in kind of timely batches. We don't review them like on demand. We review them kind of when we have a kind of set period of review. But please, we'd love to know more about things that are going on in the field.
Thanks, Kim. And because I see this coming up, this is a really quick thing to address so that folks have it. The URL to the website is pathwaystowork.acf.hhs.gov. And we'll flip to that at the end as well. But I wanted to make sure that folks had that at the ready. All right. So let's move on to the next question. And this is for Joe, Ella, and Naomi.
The next slide reads, can resources like the Pathways Clearinghouse be a useful tool when making decisions about services, and how so?
And this is, we have talked about it, I think, in the beginning, and each of some of the questions that each of us have addressed. But, COVID-19 has obviously significantly altered the way many practitioners offer their services now. So we want to talk a little bit about how resources like the Pathways Clearinghouse can be a useful tool as administrators are making decisions about services, and how you think that might be the case. So let's start with Joe on this question.
Yeah, I think, my first comment is, coming back to, I think, your opening comments, Diana, where you mentioned on the homepage, there's that link to interventions where folks are currently providing resources during, services during COVID. And I know for us, there was no playbook for what happened when COVID hit. We exist in a community, and we had to quickly come together to develop a remote operations plan just to make sure that we could continue doing business from an administrative standpoint. And then we quickly had to morph into how do we create opportunities for people to continue to receive services. At the same time, a critical need around food insecurity, housing insecurity, all these other needs that were already at play that were exacerbated by, COVID. And, when I think about, we're delivering services and making changes to how we normally operate on the fly. And we have not had an opportunity to exhale to even begin to truly document this new experience, right? So we've been, artificial intelligence and the use of technology has been at the forefront of everyone's thinking, but we were jettisoned into using these tools, using remote platforms to engage in business meetings is now a permanent part of life. Negotiating space in your home to work with your coworker who now is your partner or your spouse, right? And so when I think about, how COVID has really, impacted us and how the site can be helpful, right? One is, what's already there in terms of COVID-related services. But as we try to understand what kind of innovations are happening, what kind of workarounds are happening, how will the site over time capture those experiences through evidence that will inform, because none of us know how long we will be in this COVID space. And so for me, it's, really about how do we mine the site now for work that is taking place that's not easily discernible because COVID is such a new phenomenon, and to not lose sight of that. And how do we challenge ourselves? We have research partners. So how, it's making me think, how with our research partners do we find time to make sure that all of us who are doing work with this particular population during COVID are advancing this information so that we learn together. And that would be sort of like my general, kind of overview response to this particular question.
That's helpful, Joe. So Ella, I'd ask the same question of you.
I would say in Larimer County, we're probably more fortunate than many areas because we have had a platform for, I think, about 5 years. And I think what was so difficult about COVID-19 is that most of us had to transform how we conduct business in very little time. So there wasn't time to prepare staff maybe the way we wanted to. There were questions about technology, access for our participants or customers. So you have this massive change. The way the clearinghouse can help is that at least that's there, the information's at your fingertips. And I would say that practitioners should take advantage and send in some ideas for research and studies, because we've had to transform in a way where you didn't even know you were going to have to do something on Wednesday, and by Thursday, you had to have something in place. So some of the questions that I would have as a practitioner is, we've had to do a lot of online job search. When is that effective? When it's not? When is it not? What are the elements that make it more effective? Can we tie that in some way to entered employment that is employment, say, at a higher wage? Or what impact does that have on wages? We also know that employers are struggling. It's not just practitioners. So how do you bring all that information together? And then you can start making decisions about, here's what we need for our customers to be able to move into stable employment. Here's what we thought would work, but here's what we learned. And if you change it slightly, you may get a better result. There's so much that is happening right now. If we could capture some of this, even in case studies, and then they go on to full-blown research projects, that would be great. I think the important thing, though, is that we not wait for everything that's evidence-based. That's where case studies, I think, would be critical right now, so that we have a shared learning community, because this is something that nobody saw coming to this degree. We don't know when it's going to end. How do we learn together, improve our services, know that the world has changed, and still help the families that we are intended to serve in a way that makes sense for them too?
Such an excellent point, Ella. You know, we'll have that call for rigorous evaluations that have, looked at remote learning. But you're right, we are at a point where, because of the situation that administrators have been put in with, like, just having to, do things on the fly and try new approaches. That's exactly the kind of thing we'd love to capture in case studies, so that others can learn from those strategies that are being used. So just a plug for that. That's something that folks could consider submitting to the email address, the website for the Pathways Clearinghouse. You can submit a question and a comment about potential case studies. That'd be helpful as well. Naomi, I want to also turn this question to you, and thinking of the current situation we're in and how this resource can be particularly helpful now.
Thanks. So not a lot to add to what others have already said. Just, want to acknowledge and validate that practitioners are in uncharted territories where there's not a huge research base, but this may be, it may be that in this situation, the implementation information on the site is of particular interest.
Excellent. All right, so we will move on to the next question.
The next slide has two questions. Are there ways you would use the Pathways Clearinghouse as you think about the critical services that job seekers need most? How might you use it to think about adaptations you've made in response to COVID-19?
And this is going to be for Alejandra, Ella, and Joe. And I think, the idea here is that we're thinking of, COVID-19 has, also increased the demand for services, obviously. So we've talked about, the increase in and changes in services, but we recognize that there's likely an increase in the demand for services. And we want to talk about the ways that you use Pathways as you think about the most critical services that job seekers are looking for and need right now. And, how might you use Pathways to think about different adaptations that you might make in response to COVID-19? So let's start with Alejandra.
Yeah, I hope this isn't too much of a tangent, but I want to start with, we're in this moment in the response of the pandemic, not just the pandemic, but also shift in workplace culture with the future of work and automation and massive global labor market changes. Also with conversations around calls for anti-racism tactics and examination of structural racism and policies that have kept low-income people in low-income situations and people of color and communities of color left out of a lot of these decision-making. We're in this moment of like massive, widespread, systematic change or calls for changes, and like at least an examination, if not necessarily the change is happening yet, of these circumstances. And as a part of the demand that we're seeing, that conversation can't be left out. And so the context of the world that we're living in, I think, is something we should recognize as we talk about what targeted interventions mean. I think this is a great opportunity for us to learn from each other and learn how to engage in specific contexts and with specific communities. But targeted interventions also allow us to say, you know, we're learning together and we're creating this clearinghouse of resources of a group of different services and response to, in this, like when there is a huge demand increase. But we also have to recognize and reconcile that even the best of targeted interventions are only going to be successful in specific contexts. And we have to find ways to translate them for larger contexts and connect them to those bigger, broader conversations. And so I don't want to take us down that tangent, but just that recognition of how we approach this work, I think, is critical. And so when we do talk about adaptations to on-the-ground support systems, I hope that involves kind of recognizing the context and then finding these opportunities to learn together, knowing that it's going to take an ongoing iterative process where we have resources like the Clearinghouse that provide kind of specific examples and interventions, but also get us to a place to think about what are the next steps? How do we create more scalable solutions? How do we translate these? What does it mean for context? I was going through the Clearinghouse and finding there was examples that were specific to the Navajo Nation. Does that mean that if we took those examples for the Navajo Nation, we could translate that for, you know, rural Mississippi and the Mississippi Delta? Are there opportunities for us to learn together as we have conversations in response to the pandemic, in response to structural racism and challenges of kind of traditional policymaking, and how do we build that into our response to what feel like multiple pandemics right now? And on top of that, I think the recognition that we put a lot on our practitioners and our on-the-ground folks. There's a lot that are being asked of our service providers, and so resources like this also provide, or we hope can provide some alleviation to that burden, so that I think Ella mentioned this in Larimer County, that capacity and job roles are already being tested and burdened, and so resources can help prevent that a little bit. And so as we see increases in demand, my hope is we see more resources like this to be able to lift that burden off of county employees. I hope that wasn't too much of a divergence from the question.
No, not at all. You talked about important pieces of context that we want to lift up as well. So this was really helpful. Ella, I'd ask you the same question.
So I'm going to kind of go off my own tangent as well. One of the things that I think we could all do a better job of and getting more information is from the customers that we serve. When we have challenges, sometimes we ask them first and we're able to gather case studies around what ideas customers have, it would save us a lot of time. So this is another plea for case studies, partly because I believe that COVID-19 has demonstrated our need to be nimble and flexible under very trying circumstances for all. And then there are others in our community who have even more trying circumstances because of racism and other things that are happening in our communities that have been spotlighted. They're not new circumstances. They're getting the spotlight. So I always think that there could be more case studies around what our customers would tell us are some of the issues. That is something that I would like to learn more about always. We sometimes forget that it's not just frontline staff, administrators, and others. There's a whole population out there that is experiencing this every single day in a different way often because it is more challenging. And how do we learn from them?
That's great. Thanks, Ella. And then Joe, the same question as well.
So, this disruption that COVID has caused, both from a public health standpoint and from an economic standpoint, it is changing very fast. A dynamic that happens, it happens cyclically when we have changes in the economy and we have recessions or depressions or whatever you want to define them as. But I don't remember having something that was this abrupt and happening. So we now have folks with college degrees who are competing for low-wage jobs against people who are in really, really significant need, right? And sometimes you have people who are experienced who are looking for jobs to supplement their income because somebody else in the family has lost a job. And so this dynamic, and then we've got this other dynamic that is around what I call the new benefits cliff, where you have people who are now unemployed, who are receiving unemployment benefits, and they're having to make really tough decisions about, do I take an existing job where the wages don't equate to what I'm receiving in terms of unemployment benefits? That's what I mean by the new benefits cliff. And so people are having to make really, really hard family, business-oriented decisions. And so there is a unique need in the community that all of us are kind of aware of. If you're in a economically challenged community, you see it more. But how can we mine the site to understand, one, what kind of services, emergency services and resources are being made available? I know that, we talked about on the site that there is information that population organizations that are providing services currently, virtually or remote. But, also what things are they doing to meet the immediate needs of people in the community that might not be evident on their websites because nobody's had the time yet to update a website to put new information on about a service that's being provided. And I do like, Ella's point around how the case studies can be an example of, not yet ready for prime time in terms of evidence, but it is real practice that's happening. And how can that inform what takes place going forward as we are in this, this very complicated space that COVID has forced us all into.
This is great. I mean, I think you all have raised really excellent points, especially as site users think about the populations that they serve and what kinds of things they might want to search for. Given specific questions they may have about their own context. I think that's one common thing that you all highlighted. And I think at this point, we're going to move over to the Q&A session. I know we had other questions we intended to get to, but we want to get to the questions that our audience is submitting as well. So, Carmen, I will open it up to you. Can you start to queue up some of the questions that we've seen?
Certainly. Diana, can you hear me?
Yes, thank you.
Great. So the first question, which I think is directed to Kim, is, does the Pathways Clearinghouse cover interventions included in other clearinghouses, such as the Department of Labor's CLEAR and perhaps others? And also, how does this clearinghouse differ from CLEAR?
Okay, great. Thanks, Carmen. That's a great question. Right. So there are lots of other federal evidence reviews, and we have worked very hard to coordinate with all the ones that might have content that crosses over with ours. So that would even include the Department of Justice's Crime Solutions, but it definitely, most importantly, includes Department of Labor's CLEAR. So for anyone who's familiar with the Department of Labor's Clearinghouse, it's also an evidence review, but because it covers the whole Department of Labor, it covers a wide range of topics that are all overseen by the Department of Labor, including things like occupational health and safety. And so one of the ways in which we see the Pathways Clearinghouse as very distinct from CLEAR is that we're narrower. We focus specifically on employment and training interventions designed to target individuals who are low income. And that's not true for all the interventions that are reviewed by CLEAR. So while there are some interventions that overlap between our reviews, ours is very specifically targeting folks who are low income, and especially folks who might have been receiving TANF, or temporary assistance to needy families. But we have regular interactions with our fellow federal colleagues also at places like the Department of Education, who run the What Works Clearinghouse, to ensure that we kind of are in the loop with what we're doing and what kinds of interventions are being reviewed that might have kind of a similar audience. So yeah, I hope that helps answer the question.
Great. Thanks, Kim. I'm going to move on to the next question. And I think this one is directed to Diana. Does the Pathways Clearinghouse include interventions that serve populations with disabilities?
Thanks, Carmen. Excuse me. That's a good question, and I'd say yes. We haven't looked at interventions that focus on populations with disabilities, and one way to find those is to look at the Find Interventions That Work feature, and within that tool, within populations, you can select disability as a potential option. And I just want to pick up, I know we're not going to get to all of our questions, but other folks have asked similar questions about other populations that face barriers to employment, like those experiencing homelessness or mental illness. And my suggestion is to start with that filter as well to find the interventions that have been tested with those specific populations. Are there any other questions?
Yes. Can you, let me see here. This question is directed to Dana Rotz, who's on the line as well. Can you please speak to how interventions are rated as evidence-based?
Sure, I'm happy to take that one. So what we do to determine whether an intervention is rated as evidence-based is we look at all of the different studies that looked at that intervention. We see, we rate those studies based on their study quality, and among the studies with kind of strong study quality, we look at the findings. And then we will assign a rating of well-supported or supported to the intervention based on the pattern of findings, whether they're favorable and statistically significant versus unfavorable and statistically significant versus statistically insignificant. And I do want to emphasize here that when we're looking at the good, the high quality studies, we mean the quality of the research design governed by things like attrition and whether the groups are similar at baseline or different at baseline. It's not all about the findings. We include both kind of favorable and unfavorable findings in determining whether something is evidence-based. We use some ratings, not necessarily evidence-based, but we have ratings that we assign at the intervention level for each type of outcome that a study looks at, and those are well-supported, supported, mixed support, insufficient evidence to assess support, no evidence to assess support, and not supported. If you want, the website has more details on the precise way that we assign those ratings and the precise criteria that we use.
Great, thanks, Dana. The next question, directed, I think, to Diana. Do any of the studies or the Pathways project as a whole examine the impact on employers?
Right. So the studies in the Pathways Clearinghouse focus on the impacts on the specific populations of low income or workers that are that have low income. So that those are that's the population that we focus on, but not necessarily on employers.
We also received a question about the difference between Pathways and the What Works Clearinghouse.
Dana, would you like to cover that one?
Sure, I'm happy to take that one. So the What Works Clearinghouse, which is an initiative from IES and the Department of Education, really focuses on more educational interventions. They cover interventions from early childhood through post-secondary education. There are some programs for individuals age 16 and up covered in the What Works Clearinghouse, but a lot of the research that the What Works Clearinghouse looks at is really for, elementary, middle, and high school populations. We start at the Pathways Clearinghouse with individuals ages 16 and up. So there is some overlap there. In terms of the standards and procedures we use to look at studies, they are similar to the What Works Clearinghouse, but they're not identical. We could get in, I don't think it makes sense to get into the details here, but the protocol, which is available on the website, does outline all of our kind of standards, and I'd be happy to answer any specific questions about contrasting with the WWC if that would be helpful.
That's excellent, Dana. And I'm looking at the time, and we're at time. I think a lot of these questions, or some of them, are embedded in our FAQs on the site, so folks should continue to take a look at that. And I just want to make some final remarks. We encourage you all to visit the website. Let us know if you have questions, certainly. And we will have future webinars and demonstrations that'll be more targeted to specific audiences, and we'll have those on a rolling basis through for the next year or so. So please, feel free to tune into those, and you'll find out about them through emails and being signed up.
The slide at the left is titled Next Steps and reads, follow at Mathematica Now or at OPRE_ACF on social media. For the latest updates, use #Pathways2Work. Join the Pathways to Work email list. Visit the site pathwaystowork.acf.hhs.gov.
The webinar certainly will be posted after, and we will send an email out with the recording after, so please look out for that. And sign up for the email blast, I think, is the big takeaway, so that you can continuously receive updates. Kim, do you want to have any final remarks here? Any other comment?
Very quickly, that we're at time, but thank you so much. There was very active engagement throughout the webinar. We're just so thrilled to have so many folks who can learn about the website, and we hope you'll continue to give us feedback on what you think of it.
The slide at left is titled For More Information. Below the title are email links for the Pathways to Work Evidence Clearinghouse, Pathways Clearinghouse at mathematica-mpr.com. Diana McCallum is at dmccallum at mathematica-mpr.com. Kimberly Klum is at kimberly.clum at acf.hhs.gov.
Thanks so much for the panelists for being part of this. They're amazing, amazing stakeholders in this process.
Excellent. Thank you, everyone, for your time this afternoon. You'll be hearing more from us. Have a good day.